My job is to make sure you're able to stay healthy with food or nutrition support while undergoing treatment. I initially meet with my patients after getting consulted by a nurse or a doctor for nutrition-related issues. If at any point during treatment you begin to develop nutrition-related issues, please do not hesitate to reach out to a healthcare professional. They are the liaisons between me and you. As some of you may know, chemotherapy, radiation, and surgery may put you at risk for malnutrition or nutrition-related deficiencies. This may include loss of appetite, significant weight loss, loss of taste or smell, trouble swallowing, dry mouth, or just your inability to meet your calorie or protein needs. A common question a cancer patient has is that they are just not, food doesn't appeal to them, or food tastes different and they don't know what they can do to help with these taste changes they're experiencing. And there's a multitude of things we can do. It's a little bit more than just a simple straight answer. I'd have to discuss a little bit more in detail because it's different from patient to patient. But there's definitely options out there and different solutions to make sure that we're still able to meet your calorie and protein needs. I typically meet with my patients before or after doctor appointments, while you're undergoing chemotherapy or receiving hydration sessions, or I can even call you over the phone if there's not a convenient time to meet in person. I'll conduct my initial nutrition assessment and I'll continue to follow you throughout your journey to make sure that I'm doing everything I can to make sure that your nutrition status is optimal. If you have any more questions, please let a nurse or doctor know and I can give you some more information.